Welcome to the Darcy Wellness Show. My name is Geoff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic in Natick. And today's show is about hypertension, high blood pressure. And with me in the studio as a guest are my guests, Dr. Artur Gertler, medical doctor at the Darcy Wellness Clinic, and Leslie Barnett, certified nutritionist at the Darcy Wellness Clinic. Welcome, guys.
Thank you, Geoff.
Thanks for joining me today. So why don't we kick off with our first slide? And I think everybody kind of knows what blood pressure is. And if we go to our next one, the idea of a measurement, Dr. Gertler, of blood pressure being the systolic, the top number 120, and then the diastolic being 80. So this is an idea of what does that reflect? I mean, this balance of what in the body, in the cardiovascular system. What is this health? The idea of healthy blood pressure.
Well, technically, it refers to the tone. The pressure developed when the heart contracts, and then after it contracts when it relaxes. And it reflects the tone and flexibility of the blood vessels, how stiff or scarred they are, how much hardening of the arteries there is.
So the tone is whether they can absorb the fluid being pumped from the heart, the blood being pumped from the heart, to absorb that pressure, to expand and contract at a healthy rate.
Right.
Yeah. If we go to our next slide, the idea of, so a blood pressure that is around 140, 90, is that a problem?
Statistics are more recently showing that it is. We'd like to get it lower, even lower than 130 over 80. The lower it is, the better it is, even down to 100 over 70. So we would definitely try to treat the mild to moderate hypertension this way.
So hypertension is high blood pressure, and the idea of 130 over 80, for diabetes, mild kidney disease, and heart disease. So they've got to get down to work if they have. If you're diabetic, have heart disease, or have even mild kidney disease, if you're 130 over 80, you've got to get that down. Yeah. Why is that?
Well, sustained hypertension is a very strong predecessor for hardening the arteries, heart attack, stroke, peripheral vascular disease, chronic kidney disease. Body was not made to withstand those levels of high blood pressure, and they react by causing scarring and deposition of cholesterol in the blood vessels.
How do we know that?
Well, studies have shown that. It's very easy to correlate blood pressure with clinical studies.
So we've got like about 40, 50 years worth of experience and studies, and we know that if you're up high, you're in the danger zone. Yeah. And that's a pretty sudden, severe danger zone too. I remember when we do corporate wellness at the Darcy Wellness Clinic, and we went to a company in, if you remember, in Rhode Island, and we took a blood pressure. I think the guy was like 200 and 210 maybe over 100 and 120, and that's very severe. That's really the danger zone for what? For stroke, for
stroke and heart attack. But I have to tell you that a lot of people become very anxious when they see their blood pressure being taken in the medical situation. There's something called white coat hypertension, and it's really necessary to check it a few times.
Yeah.
And we even have home blood pressure.
So if you check it at home and you find yourself way up, then it's really just a snapshot in time. You need to constantly get to take it a number of times to get the mean average to get a sense of where the blood pressure is. Would you agree with that?
Right.
Yeah.
Sure.
Good, I'm glad you will. So if we could go to our next slide, the idea of the effects of high blood pressure on the body. This idea of pressure causing damage to an artery. In the next slide, hopefully we get it. We can see that there's a kind of a thickening of the arteries, right? How does this pressure in the artery cause damage? How does that work?
Well, it's not all worked out, but we do know that there are transmitters between the cells that relay the fact that there's too much pressure in the arterial wall, and the wall has to be thickened, as it would be when you have to reinforce a concrete wall in a basement. So the reinforcement is by sending extra muscle tissues in there, but eventually scarring is also increased, and the scarring produces the rigidity and the high blood pressure.
So the scarring makes everything more resistant.
Yeah.
Yeah. And if we could go to a slide, if there's anybody out there doing the slides. Yeah, that's great. Okay, so the effects, there's our artery becoming restricted, I guess, it would be the way to describe that, right? So on the left you have a healthy one, on the right it looks like it's kind of restricted. And that causes problems how?
Well, it restricts blood flow into the organs downstream, whether it be the brain, the heart, the legs, muscles, anywhere.
Kidneys too. I mean, how does heart disease cause kidney disease? I mean, excuse me, how does blood pressure cause kidney disease?
Well, the kidneys get a lot of blood flow, and high blood pressure causes the same damage there as it does anywhere else in the body, and it causes narrowing of the renal arteries, kidney arteries, so one or both sides, limits the amount of blood flow, and it also causes microscopic damage in the substance of the kidneys themselves.
So over what period of time? Is there a sense of that? I mean, if you don't know you have high blood pressure and you go 1 or 2 decades with your blood pressure being consistently high, in fact, some people are scared to death to go to the doctors. They don't like to take their blood pressure. Those people could be at risk of not knowing for a decade or 2 even that they have high blood pressure.
Well, it certainly is slow, and you're right, it is over a decade.
That could damage the kidneys
and
take them out, so they would need dialysis or a kidney transplant.
Yeah, eventually. It may not proceed to that stage. But.
Yeah. And so some of maybe you could cover what are some of the diseases that are caused by having high blood pressure? If we go to our next slide, we've got some of them up there. So we see that there is hardening of the arteries. Stroke. So just explain the correlation to stroke too.
The brain is very different than the rest of the body in that it has to regulate the blood pressure very carefully. It's much more fragile. And so when you have high blood pressure, many people think that the brain or strokes will develop first before heart attacks. So the cerebral circulation is really at risk with high blood pressure.
Just because those blood vessels are so fragile and so sensitive to increased pressure. Yeah. And how about blindness? Is that the same correlation also with blindness?
Well, it's pretty much the same correlation with kidney disease. The retinal arteries have plaques and narrowing and affect the retina.
If we could go to our next slide. How do you know if somebody has high blood pressure?
All you have to do is check it. But,
and how often would you? Is it generally every 2 years that you would recommend?
We usually say if you really want to treat somebody for hypertension, really be sure they do have it. 2 or 3 checks, 2 or 3 readings.
Because of the idea of somebody being nervous, being in the doctor's office, and
different times of day, and
what is the kind of how far does the blood pressure bounce around from, say, sitting on a couch all night versus being super active at work midday?
Quite a bit. Normally, an athlete in aerobic activity or anaerobic activity, you take his blood pressure right after a sports event or jogging or whatever. It's going to be 200 over 110 routinely, but it'll come down to normal within a few minutes.
Yeah.
And
so it's natural then to go up under exertion. It's just how quickly can the body normalize that? That's where a healthy system comes in.
Right. And this is often checked in exercise testing. When you sleep, it's very low.
Yeah. Like how low?
Well, I've seen people, normal blood pressures go down to 70 or 80, over 50 or 60.
Wow.
It's about as low as it can go.
Wow. And so when people faint from low blood pressure, that's the kind of ranges they'll be in because they're not getting the circulation to their brain, presumably.
Yeah, even lower than that. It may not have to do directly with, it's the regulation of blood pressure through the autonomic nervous so they don't counteract when they stand up in posture.
So the ability, when you need more blood in supply, that you can get the message to shunt more blood into the supply.
Exactly.
If you don't get that message, then you'll keel over.
Right.
Yeah. So what can people do? If we could go to our next slide, what can people do for their high blood pressure?
Well, I make it a point in a natural medicine not to treat severe hypertension. Pretty much the herbs and dietary is really geared for moderate to mild hypertension. Severe hypertension, malignant hypertension has to be treated with drugs by a conventional doctor.
So it can be controlled but not cured, basically.
Right. We can help.
Yeah.
Reduce the medicines.
And by controlling, you can really take yourself out of a number of danger zones, from cardiovascular risk to stroke to kidney disease.
Right.
So what would you consider then a blood pressure that can't be cured? How consistently, how high for how long?
I would say up to about 150, 160 systolic.
And at what point would you start to suggest, okay, now we've tried everything, we tried all the supplements, we've tried the acupuncture, we tried the diet, nothing's kicking in for you, we need to start to use some of the medications. Over what period of time would you start to recommend that to your patients?
Oh, that would be very quick, over a few weeks.
Yeah, so very quickly then. You won't mess around with anything over 150.
160.
Without being medicated.
Yeah.
So somebody comes into you, they're basically healthy, they're around 140, 190, and they've been under a lot of recent stress. How would you look to treat that person?
Well, the first thing you want to look at is their lifestyle, stress, alcohol consumption. It's a direct indicator. Obesity, and their diet, which Leslie, I'm sure, can comment on in greater detail.
So drinking. So if somebody stops drinking, is that enough sometimes to help their blood pressure?
If it's mild, sometimes it is. Yeah.
So if they've been drinking very heavily for a period of time, and it's mild hypertension, and they drop it, they stop the drinking, that will drop the blood pressure?
Yeah, that could make a difference.
Yeah. And how much is stress?
Stress can be an enormously important risk factor, especially if it's prolonged and severe and uncontrolled.
So if we could go to our next slide, it has some of the major factors, the idea of being overweight. How does overweight factor into controlling blood pressure?
Well, we don't really know exactly how it works, but being overweight, first there's the fats in the blood, which actually stimulate hardening the arteries are increased. Signals from the brain can be off in terms of controlling the pliability of blood vessels, and the hardening of the arteries can be accelerated, all contributing to it.
So, Leslie, you know, as a nutritionist, working with high blood pressure, salt's the big issue.
Mm-hmm.
I remember I had this Japanese client, and they were showing me data. The Japanese Health Ministry, I think it was in the late 90s, reduced the sodium content in soy sauce because they had such a severe, you know, the real Japanese vice is salt. They love salt. You know, sugar's not such a big deal, fat's not such a big deal, but salt is the big one. And they had such a high amount of hypertension, and all of the diseases that was caused from hypertension, that when they dropped, the government mandated a drop in the sodium levels in soy sauce, and within a few years that had filtered through into a drop in, you know, heart disease and in stroke. So how do you work with somebody sits down and says, you know, I love salt, a lot of processed food, I've got high blood pressure. Where would you start with that?
Sure, Geoff. Well, as in my practice, the general rule of thumb is I start with an awareness chart to begin with and have people keep track of what they're eating throughout 1 week. And that creates awareness. After that, we start looking at how much salt they are consuming, and I try to point out areas where there might be weaknesses in their diet. I encourage them to read food labels on any kind of processed food that they're drinking or eating, and recommend that
drinking too, because there's a lot of salt in the drinks too, right? And
absolutely.
Some of the soft drinks have
absolutely. And we're looking for under 240 milligrams of sodium per serving. That's a good guideline per serving on the label.
What's a daily recommendation for the total amount of salt? I had heard it was around 2,000.
Yeah, under 2,000, Geoff, is a good goal for people.
So a lot of the processed foods, we know that, you know, Dr. Kessler wrote this book recently on the overeating of America, I believe it's called, and he went through the food scientists, and most of the major chains have to hit 3 points. And the 3 points are certain amounts of salt, sugar, and fat. And that if they get them just right, then it will cause the brain to crave more food and not to know that it's been filled up from eating. So it makes us eat more, buy more foods. But one of the salt points that I read recently was, it was in a recent article in Time about being addicted to salt. And it said in there, you know, you should be around, I think it was around 2,000 a day. 2,000 milligrams of salt per day. And they said that Denny's steak tips had 4,200 milligrams of salt in just that one meal.
Yes,
so
isn't
it's
that
like
something?
2.5 days supply of salt in that one meal.
Yes.
So you could see that if you were sensitive, or not even sensitive, if you had a problem with blood pressure, that with the sodium, that kind of sodium, it's pathological to continue eating like that.
At restaurants, an Olive Garden, a lasagna has 6,200 milligrams of sodium, and their chicken parmesan has 5,000 milligrams.
So let me get that right. So chicken parmesan at where?
Olive Garden.
At Olive Garden has how much?
5,700 milligrams of sodium.
So you have 3 days total supply of sodium. So if after that you had a canned soup at home, you had a few drinks with sodium in it, and you put some salt on your meal, you would be through the roof.
Yeah, it wouldn't be a good thing for you, especially if you had high blood pressure.
So somebody comes in, then they sit down with you. What do you recommend, like a series of visits? How do they get down to work on shifting their diet away from salt? Because a lot of people, and I'm one of them, I must admit. I mean, I like salt, and I've got to be very careful. But there are some salt substitutes, right? There's Spike that you can use. There's Bragg's instead of soy sauce. Can you tell us about those?
Still has some. Bragg's is a great substitute. You still have to be careful with it.
It's less, but it still has a lot of sodium, but less, right?
And it comes in a spray bottle, which is really nice.
Right.
You can really manage how much salt you're putting on with the Bragg's. But there are also these wonderful spice blends that all these companies are coming out that are salt-free. And you can get a Cajun blend, and they're great on your fish or your vegetables, and really add a lot of variety and taste to your food.
So what about those kelp? I've seen the kelp condiments where you can shake out the seaweed with red pepper.
Yeah.
Is a way of also getting. Why would that be better and more of a natural source than?
Well, it's got all the minerals in it, the natural minerals from the ocean that are really very balancing for your blood and your whole system. And I also, if you are going to salt your food, I highly recommend Celtic sea salt. And this has a nice blend of minerals in it that are actually very nourishing for you. So if you have to use salt, I only recommend a sea salt. And I like, in particular, Celtic sea salt.
So what other kind of foods are high in salt then? So the canned products, I see that they're also very high in salt.
Canned products, you just want to, well, most of the processed food and then eating out are your two culprits.
Yeah.
But then you want to go over and be proactive and eat foods that really manage your sodium levels in your blood. And those are high potassium containing foods.
So it is possible, say, to go into the Olive Garden and pick something not high in salt.
Yeah, I'm sure many of the restaurants are coming out now with very diet-friendly options. You can get, gluten-free is one example, but I know that they also offer low-salt options in many of the restaurants now because it's such an issue.
Great.
And heart healthy.
So if we could go to our next slide. This slide shows that, that there are... it's tough to read, but basically what it says is that the coleus rhizome it's been used in Ayurvedic medicine for thousands of years. It's now been shown to be very helpful for high blood pressure and for heart disease in general. Hawthorn, also used for centuries by the European herbalists, is also very helpful. Garlic, there was another study showing that it's very helpful for blood pressure. And coenzyme Q10, Arthur, I know that you like a lot. There was a Mayo, did a review of 17 study at the Mayo Clinic on coenzyme Q10 and found it very helpful for lowering blood pressure. So in your practice, somebody has, let's say they have moderately high blood pressure. They've got to get it down, otherwise you will put them on medication. What do you do to get it down? You send them to Leslie, they're not eating at Denny's anymore, and now what?
Right, well, we also look at lifestyle too. Exercise is very important. Stop drinking entirely. And then if that doesn't do it, we introduce some of the supplements you mentioned, the CoQ10. Not all hypertension is salt sensitive. If it is, it does well in calcium and extra magnesium. And then there are some herbal supplements such as olive leaf extract and a Ayurvedic one called hibiscus sabdarifera, which can be very powerful. They can be almost as strong as some of the drugs.
So the magnesium is an important part too, right?
Yeah.
What levels of magnesium would you ask patients to supplement with?
Oh, somewhere between 300 and 500 milligrams a day.
300 and 500.
Yeah.
And the effect of that is that it helps to relax blood vessels. And if the blood vessels are contracted, then the pump has to work harder. Right? There's more stress on the pump. So releasing and relaxing the blood vessel is some of the nutritional function of magnesium.
Right. And there are some others that do that too, like arginine, the amino acid is relaxing.
Yeah. If we could go to our next slide, and hopefully it'll be the magnesium one. There we go. So around 400, you sometimes use more, but the idea of the Honolulu heart study consistently showed that the lower the blood magnesium levels, the higher the risk of heart attack, and the higher the risk of development of blood pressure. So that's one of the studies that you I'm sure, like and brought magnesium into the repertoire of treating patients with.
Right. I must add that magnesium is another one of these vitally important supplements, can reduce sudden death as fish oil immensely in the acute heart attack situation. And they think that 30 to 40% of all Americans are deficient in magnesium.
30 to 40%?
Yeah.
Wow.
Yeah.
And Leslie, could you tell us some sources, natural sources of magnesium, like in greens? Center point of chlorophyll is actually a magnesium molecule. So how would that translate into the diet?
Right. I think absolutely. You've got greens are the one food group that is most missing from the population today. People just don't need enough of their greens, and it's a key source for magnesium along with all the other vital nutrients in the green food. So any kind of kale, broccoli, collard greens, Swiss chard, all of them are just really great foods to incorporate into the diet that will help your blood pressure levels.
So if we go on to the next slide, this is around coenzyme Q10, and some of the research that's been done. It's probably one of the most researched supplements out there these days. This is showing that reviewing 12 clinical studies, researchers concluded coenzyme Q10 had the potential to lower systolic blood pressure by up to 17 and the diastolic by 10 without significant side effects at all. So that's part of your regime also with high blood pressure patients. I'm still kind of curious, how many people do you think in your practice, Dr. Gertler, are able to lower back to normal from moderate? I know it's an anecdotal idea, but how many do you think you're able to get down?
I think if they're willing to cooperate with dietary recommendations and see a nutritionist and follow the advice about drinking, I think the majority of them can.
The majority
I've
can.
seen that, yeah.
So it's really not a sentence to go immediately straight into the pharmaceuticals. You can get down to work in your lifestyle and with dietary supplements and have a good shot at that.
Right.
As long as it's not consistently above 150, I think you said. Was it 150?
Yeah, 160.
160, yeah. And if we could go to our next slide, there was actually here in Boston, Dr. Herbert Benson did research on the relaxation technique. It's a progressive relaxation technique. And one of the studies that he did, he's done like about 20 or 30 really, I've been in the 20 or 30 quite pronounced studies, quite with great results on simple 20 minutes a day for a 5-week period of relaxation. And that they worked with a group of hypertensive, and they found that 80% of the hypertensive patients were able to lower their blood pressure by using 20 minutes of relaxation a day, and that 16% of that 80% were able to discontinue their medications altogether. And so the idea that relaxation, 20 minutes of relaxation, and producing a regular relaxation response can lower the blood pressure and keep it down. It speaks highly to the stress has a very severe damaging impact. I mean, if that were a drug, that would be a successful hypertension drug, wouldn't you think?
Mm. Yeah, I might add that it's very important to remember with meditation that it has to be done on a regular basis. And as soon as you stop doing it, the effects will wear off very quickly.
Right.
And that probably exercise in combination is much more potent than either alone.
Right. And if we go to our final slide, there's some great, as an acupuncturist, I'm well aware that acupuncture can also lower this idea of the fight-or-flight response. The fight-or-flight response is that it flares up and it will take with it the blood pressure when it flares up, and it's switching that off. Acupuncture is great at balancing these energies, the yin-yang energies, the parasympathetic versus the sympathetic nervous system. So there was a study showing acupuncture treatments using low levels of electrical stimulation can lower blood pressure by up to 50%. It looks like 0% on the slide, but the acupuncture can lower blood pressure by 50% is another quite remarkable. So in conclusion, when we add all these things up, the idea of dietary supplement, diet, stress relief, the acupuncture, shifting the food, there's a high chance that, you were saying that 80-90% of people that work with you who do what it takes are able to normalize their blood pressure without being sentenced to a pharmaceutical for the rest of their lives.
That's true.
Good, I thought it was. Yeah. So, anything that you'd like to say to conclude in general about hypertension and your work with hypertension at the Darcy Wellness Clinic?
Well, I think that it's most people think that blood pressure always has to be treated with drugs, and I think it's a real novelty to them to see how much control they can have over it with lifestyle and diet alone.
Empowering.
Yeah, and it's constantly a surprise to us when people are willing to go the extra yard, how much improvement they can have.
Yeah. How about you, Leslie? Anything you want to say in concluding working around sodium lowering?
I think you hit it, Geoff. Really, it's empowering for people to understand that they can really take control out of one of these preventable diseases. I really do.
Right.
Yeah.
And certainly as an acupuncturist and herbalist, I work with people all the time around blood pressure issues, and I would say 80% of the people I work with get good results, either somewhere from the acupuncture, from the diet, or the dietary supplements. There's a lot that people can do, and they're not that aware of, to impact blood pressure. So, in concluding then, Artur, you treat blood pressure quite well, so does Leslie. And we'll wrap up now. My name's Geoff Darcy. I'm from the Darcy Wellness Clinic. I'm an acupuncturist and herbalist. This has been the Darcy Wellness Show on hypertension. I want to say thank you very much to Dr. Artur Gertler, medical doctor at the Darcy Wellness Clinic, and to Leslie Barnett, certified nutritionist at the Darcy Wellness Clinic. Thank you very much for joining us today. It was a great talk, an empowering talk to help people with hypertension. Thank you very much for joining us.